So a lot of the clients require care in bed, and when you're providing care in bed, realistically and optimally, you should have a mechanical bed. What this means for your client is then they need to go out then and buy some sheets for that bed. We suggest the best sheets that they should be buying are the Swift Sheets and the Swift Sheet system. So you can see we've already put it on this bottom fitted sheet and fitted as per any normal fitted bed sheet. But what's unique about it is this purple strip in the middle. This is an antimicrobial patented strip, but it also is a bit slippery, and you can hear that lack of friction on this component, almost like a parachute. So the system comes with two elements. One, this bottom fitted sheet, and the other part is a draw sheet. And it has some instructions on the side if you do forget how to use it. But essentially, the sheet also has similar type of material that when we're moving it, it moves easily and without any friction. So we're going to put the sheet over top, the draw sheet. And let's presume that in this case, maybe your client also requires a soaker pad. The soaker pad would then go directly over top of the draw sheet. And then before the client gets into bed, we could actually even tuck this into the bed so that everything stays in place. So the draw sheet is now positioned with the fitted sheet underneath. Okay, so this scene is pretty typical that we have the Glider Swift system in place, and what's happened is over the course of the evening, Chris has slid down into bed and he's a little scrunched up and we need to reposition him. So this is the benefit of this sheet system. So what we're gonna do is we're going to untuck the draw sheet. And again, it tells you here exactly what you need to do if you don't remember, but you can see we have an image here of two people. So I wanted to point out that when you are repositioning, you do need two people to do this task. Happy to have Ashley here to help out, but this may also be one of the family members in the house if there is somebody at the client's home. So we're going to hold on to the draw sheet and almost just sort of scrunch it up so we have a good grip, a lot of material. And we're going to count down that we're going to move Chris on our count of 3. So if we're ready, 1, 2, 3. And we've scooched him up into bed and he's a lot more comfortable with his legs extended. So again, the benefit being that we're sliding easily on the two slippery contact sheets that we have as part of this system. So the other benefit to the sheet system is that often what happens is we need to provide care and move somebody and turn them over for pericare. So when we do that, we can do that individually, and we're going to use a similar technique whereby we're getting a hold of the material. I would look to have my bed rails raised in this instance because I do have a mechanical bed, and I'm going to look to move Chris over onto his side. So again, I'm going to let Chris know that in the count of 3, Chris, I'm going to move you over to your side. In order to make that happen a little bit easier, we might sort of move his leg up and get it ready so he can turn easily. And 1, 2, 3. I'm going to easily lift and turn. So it requires very little force, and he's comfortable now on his side, protected with the rail. I can then move down the draw sheet, the soaker pad, and to keep him comfortable, I'm going to use the J-Row Easy Rest. So this wedge will stay in place, comfortably wedged into his back. He can now lean back, so he's well supported. He's comfortable and he's not going anywhere.